Now, changing gears, I'm excited to bring back to impact one of our favorite climate doctors, EMA Board Member and Associate Professor of Emergency Medicine at the University of Colorado School of Medicine, Chief of the Section of Wilderness and Environmental Medicine, Dr. Jay Lemery, for his daily checkup with my mom, our very own Debbie Levin.
Hi, everybody. By the way, this is my favorite thing in the world, is to talk to Dr. J, because I am
We got a lot to talk about.
obsessed. We should talk about how much I love to talk to Dr. J.
Yeah.
But
We have 30 minutes.
I did not know that there was a thing. Wait, I'm going to move this back a little. That there was a thing called climate medicine until we met 4 years ago. 4, 5?
Yeah.
4 years
4
ago.
years.
But I will say, as we know, EMA's mission is to be the storytellers for the environment. Nearly 2 decades ago, we went behind the scenes to green productions and events as well. But let's talk about how we got into the health business right now. I would say that doctors are actually our most important storytellers. And this is something that I learned from you and from your amazing panel last year. Can you talk about doctors and what their role is really in messaging and telling the story about our bodies?
Yeah. What's fun about this is that we sort of co-evolved, right? We kind of figured this out together.
Yes.
And I think it really came from that idea that we are trusted messengers. And there's big data to support that. Nurses are actually the top, but physicians are
Is that
right.
true?
That's true. Yeah,
Wow.
Nurses are like the best.
Wow.
In terms of who you trust. And then at the bottom, we won't disparage anybody, but there's less savory characters. But so with that, we know we hold the public trust. We spend all day long telling our patients.
You really talk all day, don't you?
We talk all day.
All day.
Yeah, and then if we sit at the bedside and say, hey, you need to take this pill because it's gonna unblock the artery and get blood flow to the heart. And so we're there translating abstract science.
I will say that the best call, not always for like good news, bad news, but like when your doctor calls you, you feel so important and you listen and am I right, everybody? Like if you get a call from the doctor, you're like, okay, shut up, everybody, and you focus on it.
Yeah.
So I get it.
I mean, that's the doctor-patient relationship, right?
Right.
It still is sacrosanct
Yes.
in many ways, right? And we're losing that across all sectors of society. So that's something we think a lot about. And, in the work that I was doing, wilderness medicine in these exotic places, I began to think about the science is being bashed. It's being politicized. We can debate policy, but we shouldn't dumb down science.
Right.
Where are the doctors in all this? And I thought that was a very obvious, intuitive question. And I looked around, and there was a handful of people doing it. I'm like, wow, we gotta dive into this. And so I think, but bringing it back to our conversation was when I was here 4 or 5 years ago.
Yeah.
It was like, hey, this is something cool. And I think we identified that, you did, that EMA could use this aspect to the broader mission to have that credibility in some ways the scientific and academic gravitas to line up behind the EMA mission and say, this is really important.
Right.
We know we're good storytellers at the bedside, but frankly, the only thing I've been trained to do is take care of patients. I don't know how to do any of this other stuff.
And not everybody's a good storyteller by the bedside.
Absolutely.
Right.
Right. So then it was like, well, we're onto something here, right? We've got this, powerful group that is multidisciplinary, bringing in industry. It's not sitting in an ivory tower saying, we've got to do better. It was really
Right.
bringing in solution makers and say, how, you run a business, you need to make a profit. How do we do this?
Right.
That felt really good, I think, because it was like, all right, this is actually the group that's going to talk about how to do it, as opposed to what we have to do, what we should do. And that's a lot of academia, right? We have these papers that come out. And I think the grand thing we thought about this year was, how many more reports do we need? They're very good. We have to have that science, so I'm not disparaging that. But at some point, when you're on the action arm of this thing, it's like, well, what are we waiting for? Who's waiting for more data?
Right.
And I think that's a critical point where when you're an activist which I think I am and our team is, then it's like, all right, let's meet up with other activists and figure it out, and then teach us along the way, because again, I'm charged with seeing patients and doing professor things.
Right. Well, it's also like, I think that so much of environmental activism is very big picture. And as many of you who have been here for a long time know, a lot of people talk about, we need to talk about the climate. We need to figure out, change the trajectory of what's going on the planet, when most people want to know if they're healthy and safe.
That's right.
And at the end of the day, I mean, I've been saying this for 20 plus years, we care about our kids, we care about our house, we want to make sure that whatever is in there is not hurting us. And so often, as Fran actually said this morning, our homes are killing us in so many ways. And these are environmental issues. And before we met, Dr. J, like, no one's ever put that together, that it's what you call it climate medicine or climate and health, but the reality is it's environmental issues that we're really having to deal with, that cause all different types of reactions on our bodies, on our pets' bodies. And this is the thing that is upmost in everybody's mind. And for some reason, people don't want to talk about the individual. They want to talk about the big concept.
I would actually say I think everyone wants to talk about the individual.
Everyone
in America,
does, right?
And the reason is that no one, I think as a society, we've completely failed
Right.
our social compact to one another.
Right.
With just a simple thing of like, wear your damn mask on an airplane.
Right.
Get your vaccine because it's actually going to be better for
Right.
your elderly
It's
neighbor.
It's not
And
political.
we've weaved away from that.
Right.
And it's really interesting because so people will come in and with their whatever, and you're talking to them, and I'm like, did you get your vaccine? And when we could start to offer vaccines in the emergency department, it was like, oh my God, this is great. We're going to solve this problem.
Right.
And people would be like, no, I don't want that. I don't trust the data. I'm like, do you know, can I swear, do you know the shit that I'm ordering for you right now for your abdominal pain and your cough is potentially nephrotoxic drugs or all these things, but we do it, and we do it quickly because we know that's the best evidence for emergency medicine.
Right.
And I'm like, do you have any curiosity what I'm doing? And you're cool with that, right? And they're like, oh yeah. Like they'll say that. They're like, yeah.
And
ahead,
yes,
doc.
no
Go
one
ahead,
knows
doc.
what
Do whatever
any
you
of that
want,
is.
but don't give me that damn vaccine. So I think that in some ways, in a perverted lesson from there is that we actually do still hold the public trust, because for things that aren't being hammered on in crazy, denialism circles, people still get freaked out and go see their doctor.
Right.
You know what I mean? So I think that's the opportunity I think we have, is to bring that health messaging here. And I would say, I know Emma is chopped up into different groups, but this to me is the ribbon, and you and I have talked about this, right? This is a ribbon of consistency that should flow, with a few other things within everything that Emma touches, right? What's the health angle, and
Right.
how are we improving upon that? And
Health is everything.
yeah,
Health is everything. And health is what we're looking to give the next generations. So people talk about saving the planet for the next generation and next generation. What we're really talking about is not only a healthy planet, but our bodies have to be able to react to our environment in a healthy way. And I definitely think that there was a wake-up call a couple of years ago. But I think even now people are like, oh, but that was a weird virus. I don't know why that happened. So it's, the thing, like being out, I'm so not even reading this at all, but like, being out and doing wilderness medicine, to me, that was the first thing I learned about you. And to me, that just is in your face. I'm in the elements. What's the stuff that could happen to me? But
that's right. Yeah.
But an inner city is a wilderness.
Yeah, I mean, it's
everywhere is a wilderness.
Absolutely. Interestingly, some of the craziest cases I've ever seen in the wilderness happened at Bellevue Hospital in New York City. And it was because the world came to you. And I think that's, there's no separation. The thing about wilderness medicine is it's a subdiscipline It's the art and science of taking care of people in remote and austere places. But then there's things, as you think about that, we're charged with taking care of human beings in those places. How can they thrive and use best practice methodologies of 2022, but also paying attention to the very unique ecosystems that people don't get to, whether it's desert or marine or polar. And sitting there and hearing the stories of the natives, and I think we talked about it last night about, we were in Greenland, and the Inuit were talking about how because the sea ice was melting, it completely disrupted their fishing habits, where they couldn't actually go out on the ice, so they were going to the food desert in their town and getting Doritos, and that was where their meal was, and so diabetes were skyrocketing.
Wow.
And we spoke to the local care provider, and he's like, yeah, it's the sea ice is all wonky, and people don't know how to regulate the normal ebb and flow of nutrition. And this small community is just blowing up with overweight diabetic from diet. And that was like, wow, I would have never put that together, but thank you for sharing that, because it's a very powerful anecdote.
Sense. It's so logical. Can you talk about the messaging around optimistic conversations, if that is a real thing, or do you think the media is airbrushing some really dark trends in our society?
Yeah, I mean, it's a great question. I think of how do we find optimism? I think it's really important for us to think about that. But I also say, this isn't the first time we've been here. So I reflect. I've been watching a lot of Ken Burns. It's been my post-COVID binge. 19th century things. But you think about what they fought a war to rid the world of owning the issue of owning other people, and then they fought hard. These our ancestors to build libraries and build knock down and procure real estate to build these beautiful urban parks, and the suffragette movement, women's right to vote, and even the temperance movement and the betterment and things like that. And I know that those people were in despair. It was very dark. Right. They thought nothing will change, and they had formidable obstacles, and yet there they were, changing our operating system for our society. And I love libraries growing up, right? That would have never happened unless those people leaned in. So I think we're witnessing that now, and the challenges are unprecedented. I think that's the freaky part. What do we do with social media disinformation, or people who are throwing away democracy just because it's a power play? What does that mean? I don't know, but I know analogous things have been here before, and people organized and leaned in. And I'll just tell you, the last day, looking around here, there's a ton of optimism, and people are there doing it from groups that it's hard. They were maybe responsible to their shareholders still. That's really their fiduciary responsibility, but they want to go further because they know they're looking beyond that. And I'm like, well, that's optimism right there.
Right, that's true. And I do think that there is a generation that is we have several amazing people right here that are not going to tolerate a solution. It's like we definitely have more of that tomorrow, but this is their world. And, if you're 20 years old, you're not going into this and saying, "Oh, I'm fucked. This is over." You're not doing that.
Yeah.
You're going in. You're saying, "What can I do?" And that is optimism, and that is solution oriented. There is definitely a generation, and I'm part of it, that was so doom and gloom, and still does. And I get emails every day from somebody, "Oh my God, this is horrible, and what are we gonna do?" And I delete. That's not what we're doing.
That's right. America loves winners, right? And we have not done any justice, any of us, bringing forth the best science and laying it out and saying, here are the sacrifices we need to make.
Right.
I remember, my generation, and many people here, probably half you don't, when Jimmy Carter got on the TV, wore a cardigan sweater,
Yeah.
I don't know if Mike's here, no offense, your sweater was great last night. Cardigan sweater, where he sat there and he's like, here are the sacrifices we need to make. And it was absolutely a spot-on assessment,
Right.
but no one wanted to follow him, and you understand why if you go back and look at that. It was a
Right.
complete failure of leadership because he didn't read his audience at that point, right? And I think
Right.
that is why we have got to pivot, to our colleagues here and thinking about look at that electric vehicle. Look at the progress we've made.
Right.
There's a lot to be optimistic for.
Right.
And I think changes and sacrifices can be part of it, but you have to lead with like, oh my God, good news, everybody.
Right.
Here's how we do it. And I think that's something that academia hasn't done very well.
No.
Right, because it's all, here's the data. And
Here's the data. Here's
again,
the facts.
you need it. I'll just say one more thing that I think gives us and my colleagues here a little bit of an edge is that we are science communicators. We are your doctors. We are not environmental science researchers that are NIH funded that have to prove within a 95% confidence interval that the data we're presenting is the data that is, to put it up there. So they have to equivocate and they have to concede we don't know. And the reason they don't know is that's what science is. No one is publishing papers on gravity. Like, we got that. Right? They're publishing on stuff that's the vanguard, that's the unknown. Right? We don't have that burden. We get to act quickly and confidently. And the reason is that when you come in with sepsis in the emergency department, your blood pressure is tanking, your heart rate's sky high, we're not going to sit there and talk about, well, I really ought to have 95% confidence interval before I give this person antibiotics. You're like, oh my God, this is sepsis. It probably is. It may not be. I'm not wasting any time. I'm going to start immediately and treat that patient because the consequences are so bad if we don't. And so that's a much more comfortable place for us to live as science communicators than funded researchers, if you see what I mean. And so that's why I think, again, we've found our voice. And we'll talk a little bit more tomorrow about how we've leaned in and we're trying to amplify more young voices.
Well, obviously, the public is starving for doctors to talk to them. We've got more doctor television shows on, than any other genre, and have for as long as I can remember. People want to see that interaction, and we know that in an emergency room, you have to just act, but we only know that because we're on TV, we're watching it. So
you've probably seen it though if you're in the emergency room,
oh, totally.
You're hanging out.
Right.
I'm sure no one's ever waited
Everybody
in
hangs
the
out.
emergency room.
No,
that's
you
not
get
something that
immediately
happens.
in and you get treated.
But
like
you see,
that.
you see the crazy stuff come by.
You see the crazy stuff. Okay, regarding communications, the million-dollar question everyone is talking about: how do you confront the disinformation in the medical world with your patients? Much like you said, I don't need a COVID shot. I'll take 4,000 medications to make me better that I don't know what they are. What do you do with that?
Yeah, so Ed Maybach is a communication PhD.
We met Ed.
You met Ed.
In Scotland.
Yeah, Ed, that's right.
Yes.
We'll talk about that. And he basically is a communication specialist, tells us how to talk climate and health, and it's evidence-based, so we understand it. I think the thing you do is that you try to connect. And that's, again, I have 3 minutes to connect with you at the bedside. And I'll say, what's going on? Tell me what you're worried about. I'll hold their hand. You kind of can lean in and say, what is it that bothers you? Can I assuage your anxieties? Right? Can we get into it? And about half the time, that will disarm somebody to let that interaction, seep through the prejudices that they would have from, Fox News or whatever. The other segment is like, no. And I'm talking about the vaccine, I guess. Right. And with climate stuff, we have collectively, and I think we've been led by our communication specialists to say, work with the people you can work with and use all those strategies, trying to connect on common values, trusted messengers in their world, whatever their cultural world is. But in the end, you leave them behind. It's just a waste of time. And I'll just tell you, it's one of the grand tragedies of, I think, our professional lives where we've lost 1 million Americans. 1 million Americans are dead. And I don't know the number, but so many are preventable. And we've, witnessed that. And you're just like, this is the cost of disinformation.
Do you think so many of those people just didn't believe stuff?
Yeah, I
You
do.
do.
Now, many perished before we had a vaccine.
Right.
And that, can you say it was mask wearing or not? I'm not going to talk about that. But I'm going to say when we had a vaccine, the data was beautiful. If you're vaxxed and then boosted, what came later.
Right.
Like you're just not going to get super sick. You might be miserable and a work note worthy,
Right.
but you're not going to be in the ICU with kidney failure and die.
Right.
Those numbers plummeted.
Right.
And it became a cold. People die of colds every year, but that number is like this, so it's
Yeah.
not something we've ever thought too much about.
Right.
And that's what really has happened with COVID,
Yeah.
post-vaccine.
Yeah.
Right. So again, it's an absolute tragedy, and I don't know how. There were many mistakes made, right, in how we messaged it, public health
Right.
messaging, but
Right.
yeah.
I know, it's true. I mean, you got to trust your doctor.
Was that the optimism question?
Yeah, that didn't sound so good. So let's see what the next question is. That was a little depressing. I want to talk about another of the most optimistic aspects of being human, and that's our children. One of the most important ways to serve the next generation is to leave this a better place than we found it. As a physician, how are you communicating this to your patients? And do you feel like you're being successful?
Yeah, I think that was what I alluded to a little earlier with like my reflection on the 19th century, where people were changing the world, and it was really hard, right? And I think when I read the news and I reflect on, we wrote an essay years ago called "The Great Procrastination," and that's what we're living through now. I think will be labeled, the epic of the Great Procrastination, when we had all the data we needed, but collectively we couldn't move on it. And I'll just say, I think, right now, I look at the work. We haven't talked so much about the fellowship, but we're trying to build climate doctors. We're going to talk maybe a little bit, and certainly more tomorrow.
Yeah.
But that is a worthy legacy for all, our group to be leaning into. It's like, I don't know it's a training program. I don't know what the impact is going to be, but I know Bar and Emily, who are sitting right in the front row, will force multiply throughout their careers, and they're still training, not for much longer. They're going to put their own imprint on this, and their own passions will come to life. And making it hard on ourselves, but I think that is another potential thing that I think EMA could help with, which is like all the partners here is, hey, we've got some climate docs, freshly minted, talk to them. And maybe there's a role for advising or otherwise
Right.
that I think could help.
Right. Because actually, climate medicine is in every medicine.
Yeah, I mean, we're inventing it. We don't know what climate medicine is.
Right.
What we do know is that it's an extraordinary complex thing. How do you talk about carbon capture and biodiversity and geopolitical oil swings and disaster response at state and federal levels? I mean, it's a lot. And you can't train anyone on that, but you can definitely get clinicians to be savvy and have a 360 to hold their own in a conversation, when they're up against a CEO or an executive director or a dean or a politician, to be like, no, that's not how it works. Actually know how it works, and then bring that credibility of, let me tell you about the patient I saw yesterday who was struggling to breathe because the air quality is so horrible
Right.
from the wildfires that
Right.
that are sitting in our town,
Right.
So it's a thing.
Right. So, but you created the concept of a climate doctor
I would say collectively, our group did, for sure.
collectively, but
Yeah.
why do we need one on the EMA board? Other than the fact that I'm obsessed with the idea of climate medicine.
I would say again, it's a spark of enthusiasm and expertise and energy that can inform every aspect of a group, which by all accounts, I think, the long history of EMA, 30 years?
Yeah.
Right? 32 years.
Yeah.
How has it grown?
Right.
And to have, if I'm the first, now there's a whole ecosystem of others that can come in and empower those missions and empower the missions of the partner, right? So now the EMA ecosystem is richer, and instead of 4 or 5 years ago, me having some sparky ideas around this, now there's like proper training and proper policy understanding and much more connectivity with federal agencies in Washington and NGOs doing this work that will be frankly just much more informed. Like, and how do we get it done? How to strategize?
Well, and also using our ability to tell a story with the facts that you're talking about.
Yeah.
And then hopefully getting that into content.
Yeah.
In a way that's different than what we're seeing on the 86 doctor shows that are on.
Well, I actually think a doctor show on this, the 87th,
we
would
should
be
do it.
Very powerful.
Okay,
right?
we can sell a show today, guys, right?
I don't know exactly what the format would be, but clearly,
I don't think it's a sitcom. I think maybe not.
No, but I mean, I think we have what's called the Climate Action Platform, which is sort of demonstrable, optimistic solutions that are already happening.
Yeah.
And it's a little bit separate from the pure training program, but we have physicians training wildland firefighters in medical skills. These guys, they're mostly guys and women, have no medical training, and they're out there fighting fires, and we couldn't believe it. So we pitched the U.S. Forest Service, like, how about you give us 3 days, we'll get these guys at least a little bit of ability to take care of themselves and each in each other. And so we have that going, and that's great. We're doing disaster training in the Northern Marianas because, guess what? Like, the highest point on the Northern Marianas, is like this couch, right? So they're going to be underwater soon. One of our fellows, one of our colleagues right now is in Summit Station, Greenland, right in the middle of the ice sheet, supporting the National Science Foundation scientists.
Wow.
So he's there.
Yeah.
Again, any of these could be a great episode. And then, and then even other things like leaning in and trying to, this is not such a great episode, but it's upgrade the medical coding. So instead of shortness of breath, we can say shortness of breath, hottest day of the year. And that attribution science at the bedside is really important for us to look back and say, okay, now we can start to create these linkages, to petition for federal funding or hospital improvements, right? And again, we've done a little bit of data bashing on the early end, but data is so important because that's how you convince stakeholders to pivot.
Right.
And if you can measure it, then you can demonstrate improvement and that what you're doing actually is affecting those endpoints.
Wow, right. No, that makes so much sense. We went to Scotland together for COP26, which was so fun and so interesting. What do you think the point of us going there was and the lessons that we got? And what do you think we can do for better communication next time? What we found, the two of us in the group that we were with, is that the communication from COP was like non-existent. It was a bit on the news. You really didn't understand what was going on, and it was very insular. And it's sort of the opposite of what we do, which is we want to have everything we do be public so that it can be educational. There's no point in us having this impact summit if no one else is going to see it and it just stays in the room. And I feel like COP stays in the room.
Yeah, that's a powerful. So I would say, what is COP, right? It's the Council of Parties. It's the grand get-together for governments and NGOs and policymakers on climate change, not climate and health, big climate change. It's a 2-week thing. It's every year. The first couple days the heads of state are all there, and they come in and they do their thing. And then the next 10 days, it's all different things. This year, I couldn't believe it, but this was the year where actually led, because it's UN based, so the UN's health agency is the World Health Organization. The WHO had a big presence at COP for like the first time, and 26 years. Right. That seems a little late, but better late than never. And so health played a very big role.
But we were also in the pandemic, so kind of had to.
Yeah, I mean, I'll give them COP 24 and 25, but 23 they should have had.
Yeah,
right.
That's true, right.
But they were that was quite exciting, and it's really kind of the impact summit of the world around climate change. For those that don't know, there's a blue zone that is hard to get into. You need a credential from an NGO. There's the green zone, which you have to get tickets for ahead of time, and then there's a bunch of side events. And this is where you've got student protests marching in the streets. You have sit-in, death-ins, I guess, where the people are protesting. Different groups show up. The New York Times was there and had this awesome thing that they put together. So it's kind of a circus atmosphere. Frankly, I was quite reluctant to go. We had our benefactor was like, "You got to go." Once we were there, the connectivity and to be able to talk to everybody about this made you feel like, okay, this is so important, and to be able to see what other people are doing. Right. And in turn hear their great ideas, and we can pitch to them. We presented at the WHO pavilion, so it was a it was a valuable thing. I think it's a hard thing for an individual to go, but I absolutely think EMA should be there next year. An EMA contingent.
Again, it was a lot of noise coming out of it. You saw the protests, you saw the heads of state, but I don't know that anybody at home watching could understand how important it was. And I feel like there's a story that's not been told from there, that people are coming together for the singular reason that we're all sitting here. And that is not being communicated.
So you're right, there was no driving consensus on anything. People just showed up. So I think we had to be aggressive.
And this was our first time going, so I don't know what it was like before.
And my first time.
Right.
Yeah. So you had to kind of be aggressive and just dive into something and be like, "Who are you?" Shake their hand and figure it out. I will say this is that Undersecretary of the HHS, Health and Human Services, right, department, they run their hospitals, right? It's all where the money comes for our hospitals. It's an admiral. Her name is Rachel Levine, stood up and signed on, the American secretary signed on to the World Health Organization pledge to decarbonize the U.S. healthcare system. So just in my short time left, I'll just talk a little bit about this, which is, what's the first rule of medicine? Do no harm, right? So we have to kind of look in the mirror. And that may be a little bit gratuitous, but you actually think about it like, okay, American healthcare is 18.5% of the U.S. GDP. It's about a fifth of our economy, and it's about 8.5% of entire United States carbon footprint. If you've ever been to a hospital and just kind of spent time waiting in the ED and seeing the amount of waste that just flows past you, you know why, right? This is a huge deal that finally, and to me, talk about optimism, this was like, oh my God, finally we have a high government official signing on, making a public pledge to do something that's so important. Right? So I think in that respect, that's a big win for a big sector of the U.S. economy where, that's going to be a priority, for instance.
Right. I think so. I think that, in my fantasy, there's a crew doing a documentary going to COP. And
I mean, that'd be fun.
Well, I also think it's necessary, and I can't believe it hasn't been done yet.
Yeah.
So we should probably talk to the people from this morning, to all those Discovery and Nat Geo, because how is that? Because everyone's not going to go there. There's this tiny little percentage of people that are ever going to get to go there, but there needs to be a better way to communicate to the obsessively content-hungry public that this is something that people do care about on a global level, and that there's solutions. And here we are really taking it seriously. And maybe it's because you just need to have somebody go there and shoot. So I'm going to just say that.
I don't know how one would put that together, but there's so much there. So much there.
We know people. We need to figure this out.
I want to ask one thing, which you and I talked a lot about, which is the relationship with the Hollywood Reporter.
Right.
And we thought this was, I've talked to some of the principals there as well last night, but how do you envision the health aspect of EMA, triangulating with a Hollywood Reporter, and getting those messages out there within the entertainment industry?
I mean, I 100% think this is of interest to everybody. I think that we all realized that we were more vulnerable than we thought we were as just humans. And I think that, maybe we can persuade our friends at The Hollywood Reporter to, like today, right now, they've got a full digital issue that is 100% about climate. They've never had that before, a sustainability issue. And no other magazine in the entertainment industry has dedicated an entire issue to sustainability. So, yay. But there should be, health, quarterly health check-ins about climate health. And, get really big celebrities to talk about it so people will read about it, And who's not going to want to be interested in health? And so I will talk to my girlfriends at The Hollywood Reporter. I don't know where you guys are. We're not up to questions yet. It's my child. But we should really talk about. This is something that obviously affects everyone, and having such amazing partners that have the attention of everyone in the entertainment industry and beyond. Because now anything that's picked up gets picked up everywhere. So that's a realistic goal. That's a really realistic goal that I think we should open up for questions really briefly on that note.
Two quick things. One, I just want to thank the sort of our benefactor, the Climate and Health Foundation.
So much.
Who couldn't be here. They're actually at an event they have to host.
Right. Thank you, Jenny.
So they've supported EMA.
Yes.
They support our fellowship. And then also just to say, tomorrow morning here, we're going to have our newly minted climate docs on stage, and Miss Frances Fisher is going to talk with them about
deep dive into exactly what a fellow is in this space, and also if it's exclusive or it's something that you do with another subspecialty. So that's really interesting. Does anybody have any questions? Alex does.
I don't see anyone. Yeah, we're good.
Will I get a mic? Ooh. Hi guys. Ooh. I have two types of questions. I have a two-part question. One, how can you explain, like, with colds or viruses and whatnot, it kind of was always in the wintertime. It had a season. And now I feel like it has no season. And the fact that we are going through such climate changes on and off, where the weather is constantly up and down and changing. And I feel like, people are getting sick because of and is that is there a relationship between the fact that people are getting sick because of the changing of climates? Is that something that goes together?
Yeah,
that makes sense.
It's a good question. So first of all, we know different viruses have different seasonality. Influenza loves the cold, and right now, it's peaking in the southern hemisphere, for instance. And so COVID, I don't think we know where it's landed yet. Right? It's relatively new, and it hasn't hit that equilibrium. So clearly, there's a seasonal proclivity for different viruses. To your second question about, is climate change going to drive this? Well, I would think about it more that when we are disrupting our ecosystems to this huge degree, so it's land use, it's climate change, it's water usage, we're forcing more what we think was pangolin and a bat maybe, or I'm not even quite sure, but we're forcing more disruptions in the ecosystem, and that equals chaos. And we know a lot of novel viruses come from novel interactions. There's some good data on that. I'm not an expert on that, but I think the thought is that we're more at risk because our ecosystems are just being under such stress.
That makes sense that that's happening.
Yeah.
Okay, guys.
Any other questions?
Hi there. Sorry. I guess my other question would be that the physical health side is like so important for people, right? Like people who experience natural disasters or see their homes being ripped away. Do you see climate doctors also collaborating with climate psychologists? Because we all know that if our physical health is not good, our mental health is probably going to get bad. Or if our mental health is bad, our physical health is also bad. And I think that a lot of the times people don't know how to ask the other questions of, okay, I got physically taken care of in this hospital, but now mentally I don't know how to navigate this conversation or to go back
Yeah.
to my environment now?
For
That's a
sure.
great question.
Yeah, no,
Go.
and it's not even an issue in the sense that absolutely it's been there the whole time. We pay a lot of attention to it. When I think of the Dirty Dozen or top 10, it's always right there. There's a very powerful graphic from the New York Times after Hurricane Katrina, 2005, right? And that was, again, a tropical cyclone that hit New Orleans, and it ended up being a big urban flood. Why do I bring that up in 2005? Because we're going to be seeing a lot more of those, right? We know hurricanes are being energized. The map was of the diaspora of New Orleans splayed out over the United States from forced displacement. So it was a big black dot in New Orleans, and it went like this. And it was hundreds of thousands of people that had to move out of the neighborhoods where they grew up, their friends, their family, their jobs, their well-being, their health care, and they're living in North Dakota or Iowa or Tampa, right? Incredible psychological stress for that. We also know, right, this is not surprising, during a hurricane, things flying around, people get injured. I think the thing we don't talk about a lot, but it's becoming in the press more, is the low-grade cloud of dysphoria that is sitting on the American public, children as well. How do you talk to kids about climate change? We sort of had to deal with the threat of nuclear war, and I think that threat still exists, but it was perhaps a little bit more in the 60s, 70s, and 80s. It was a thing. So I think it's analogous to that, which is like real fear. And I know that my daughter has a little friend who's just a mess of nerves, and this is one of the things she keeps bringing up. So to your point, it's very well recognized.
We have time for one more. We're good. Thank you so much.
Thank you.
Thank you so much. I love this.
Let's do it again tomorrow.
Yes, we're going to do it again tomorrow.